when the healthcare system gets overwhelmed, it's our big problem. I mean, I think you only have to walk into a hospital in New York City one time to realize that this is not overblown.
Hey everyone, I'm Alex Renneman from Unleashed Tygart, and I'm here with Dr. David Bender, who's acting as our Taylor County Health Officer here in Taylor County, West Virginia. Dr. Bender, thanks for coming on the program and really helping us understand more about what's going on with COVID-19.
Oh, you're welcome, Alex. I'm very involved here with the community and fighting this, and I want to reach our citizens here.
So I'll extend some early gratitude to you from me and everyone else who's listening and watching this potentially, that you have plenty of things in your schedule right now. And so for you to find some time for us, super
Right.
grateful. Let's jump right in. Can you help us understand what's your role as the Taylor County Health Officer?
Yeah, so it's a position that's appointed by the state, and I'm the overseer of the health department. Now, frankly, when I was appointed to be the overseer of the health department, I didn't think we'd be dealing with a pandemic.
Right.
But I take that role seriously. I want to try and help the folks here in Taylor County, and so we've tried to jump right in.
Well, we're glad you're here. Can we talk a little bit, just your perspective, riff a little bit on what is COVID-19 and what are we up against here?
COVID-19 is what's called a novel virus, coronavirus, that causes this infection. Novel viruses are always trouble because we don't have immunity to them, and so that's problem number one. Problem number two ends up being that this particular novel virus is a little bit deadlier than most viruses are, and that's really what we're up against, is the deadliness of the virus.
Yeah, so I hear lots of people comparing it to the flu. Some comparing it, you get both ends of the spectrum. I imagine the truth is somewhere in the middle. Can you help us? How different is this than the seasonal flu that we see come and go every year?
So the seasonal flu, we see lots of cases of it over time, but we're talking about lots of cases over 6 or 7 months. With COVID-19, we're seeing it hit us over a 2 to 3 week period, and those kind of problems overwhelm the healthcare system truly, and so we can help less people in the case of a pandemic infection like this. It's certainly more deadly than the flu, at least 10 times more deadly than the flu, and we haven't seen an influenza outbreak even similar to this for over 100 years.
Yeah, that's it's kind of scary in some of those statistics, as you see, and obviously the data will play out as we have more and more volume, but the more and more volume, unfortunately, is not a problem. It's coming every day across the world. What have we learned about how it spreads, its surface life, those kind of things, so we can know what kind, because it's so scary to think there's this microscopic virus that's after us. But what are some things that we're finding out that we can kind of know? All right, obviously you can't always contain it because viruses change, but what is it that we can really look at in terms of how this thing works?
Sure, it spreads by droplet, and so typically that's going to come from a sneeze or a cough, something of that nature. And then that droplet is going to get aerosolized and spread out if we inhale it. That's certainly the worst thing. But oftentimes what we find is the droplet lands on a surface, be it a countertop or an elevator button or a doorknob, and then we touch it with our hands, and then we touch our face, and then we have it in our respiratory system.
Yeah, makes sense. And I guess I've heard things, surface life could be anywhere from 3 to 6 hours laying on something, depending on what the surface is. Is that about right?
Well,
okay.
So coronaviruses in general have a life of up to 7 days. That's under perfect circumstances, however. And so for most of these coronaviruses, the life of them is, 1 to 2 days at the most. They need to find a host, and our hands end up making us a perfect host for them.
Yeah, that's a good point. So, this is a relative term, but is this all overblown? I mean, is this as serious as it seems to most of us? And again, everybody's perspective is going to be a little different, and the media says one thing, but how serious should we be taking this?
Very seriously. I mean, it's not that we're going to see so many folks infected with this. It's that we'll see all of the infections happen at one time. And when the healthcare system gets overwhelmed, it's our big problem. I mean, I think you only have to walk into a hospital in New York City one time to realize that this is not overblown.
Yeah, let's dig into that a little more, because that's that whole idea of flattening the curve. You know, you see there's tons of great graphical images people have done with data to show here's what happens, hospital capacity. I've shared some on Facebook myself. It's fascinating. Can you, from a healthcare perspective, because you're right there, can you help us understand why it's so important to flatten that curve?
Yeah, so if we can handle the cases over time, we can help to we can be better prepared for them, and by doing that, by flattening the curve, so to speak, where all the cases don't happen in a 7-day period of time, we can better care for folks, and our resources aren't tapped all at once. The way that we flatten the curve is to practice what are called mitigation strategies, or strategies that limit the number of people that are infected at any one time, by limiting the number of people that the virus can potentially affect.
Yeah, that's so, obviously many of us may get this, but the better thing is we get it over time. So it's not only resources from staff, personnel, to hours, but beds and respirators and all the Medicaid, whatever it needs. It's all of that, right? I mean, we're not built to handle that kind of surge in any capacity.
Correct. I mean, in West Virginia, our main concern, for example, is our elderly population, and if too many of those folks get affected, then that really will put a strain on the healthcare delivery system. But if we can flatten that curve and folks are affected more slowly over time, and hopefully not nearly as many folks affected, we can fight this a lot better, and frankly, not as many people will die from it.
Yeah, and you can still see occasionally the media will show some knuckleheads doing some things that they're violating containment strategies and those things. But really, I mean, by and large, I mean, I know folks, I think around here, they seem to be doing a great job, and I'm really appreciate. I know West Virginia's pulled together in times like this. I mean, we help our neighbors, and that's the big thing. I may not be in the demographic that's a super high risk. Doesn't mean that it could not hurt me. I mean, we see people of younger ages, on respirators and have some serious issues, but certainly that target demographic for this bugger is in that higher rate, 70, 60 plus, right? Maybe with other comorbidities, lung issues, but that doesn't mean that people that are healthy and young could be a real problem with this if they continue to spread it, right? I mean, that's a real message people probably need to hear.
Well, that's it. I mean, if folks take it seriously, we can contain this to a degree. And you're right. I mean, it's the younger folks right now who are out and about more that, don't get sick. They get a cold or a mild flu, but when grandma or grandpa gets this, it's a completely different story. And that's really why we have to practice our strategies, our staying at home and our social distancing and our hand washing, all of those things that we can do in a real-time way to help us out here.
That's right. I mean, yeah, it's clear we are not powerless in this, and that's a bell you can't unring. I mean, if you pass that on, you pass it on. You can't pull it back. So responsible containment mitigation strategies are key here. Can we shift a little bit into, so how does somebody know, what are those symptoms? What are things they really should be looking for in order to know maybe I should be calling about testing? We'll talk about testing. Can we kind of start down that path?
Yeah, sure. So the main symptoms of COVID-19 infection are three: a fever, and that's the very most common symptom. About 9 out of 10 people will have a fever with this, but often with the fever comes a very dry, harsh cough, and sometimes also with this will come some shortness of breath along with that.
Okay. Yep. And then, but some of those which one should really, because obviously fever, we get fever with all kinds of different viruses that come and go. Is the shortness of breath the one where you should go, I better call my doctor? Or at any of those, a fever or a dry cough, at any point should you call somebody?
Well, I think the fever especially is where you want to think about, hey, something's going on here. I think most of us have had a flu or a strep throat at some time in our life. It's going to feel like that initially, and that's a good gauge for us to say, hey, I need to see if I have a problem here, and should I be tested, and what should I be doing to help myself?
Yeah, that's really good advice. So, all right. So I do have, I do think I have a fever. I have shortness of breath. I have dry cough. Any one of those three. At what point, what do I do now? Do I call somebody? Do I run to the hospital? Do I run to the medical center?
No,
What would I do?
so you don't want to run to the hospital. I mean, because again, that means people are going to have to get into a gown, et cetera, et cetera, et cetera. You're better off calling your provider first. They can let you know what to do. If you call, I'm just going to give you an example. You could call the Grafton Hospital if you live in Grafton or Taylor County or in this area, 304-265-0400. They will put you in contact with a provider. Usually it's me, who performs a medical screening examination over the phone, and we can decide right there if you need to have COVID-19 testing, if you're a candidate for drive-up testing, which is the best way we can do it right now. If we just need to say, hey, stay at home, let me know if anything changes, if you get sick, but right now I don't think you have the signs or symptoms of COVID. Or I can tell you, hey, it sounds like you're pretty sick. You need to come to the emergency room, and let me give them a call and let them know you're on your way.
Yeah, this is truly the old adage: an ounce of prevention is worth a pound of cure. So if you have any of these symptoms, I mean, that's something. If you got to get stuff from the store or whatever, phone a friend, man. Somebody will help you. I see people all the time on Facebook. I love it. Say, do you need any help today? You need anything? If you're feeling these things, stay in. Right. I mean, that's the message. But
Yeah.
So let's say, okay, so I need to go get tested. I know we have a center here in Grafton. I know for a while that was a challenge of getting testing out to everyone, and we may see numbers spike just because now we have more testing. But what process do we have here in the county for folks if they do believe they're positive and their provider said come on in?
Sure. So if they call that phone number and we ask them to come for testing, what we do is we pre-register them. I give them an appointment time. Our testing site in Taylor County, very graciously, the Board of Education has allowed us to use the parking lot of the high school, and the Taylor County Health Department and the Grafton City Hospital working together. We have a pretty good setup. You come in, you pull your car up, we talk for about 5 minutes. We have you either wait in your car or sit in a chair, however you're most comfortable. We do your swabbing, which takes about 30 seconds. We let you get back in your car and go home and just self-quarantine yourself until we let you know how your test results have turned out.
Yeah, that's key. One of the folks asked some questions in when we had put some stuff out earlier. And one of the questions was, okay, so I think I have this, or I'm struggling through this. Is ibuprofen? What are the things I can do while I'm waiting? Now, obviously, their doctor, whoever made their doctor, may have specific advice. But just generally speaking, if folks are kind of wondering, maybe I got this thing, what in their mind, what are the kind of treatment procedures at home?
Yeah, so Tylenol is a real good choice for fever and aches in general. It's a very safe medicine. Ibuprofen or Aleve, Advil, those type of drugs are a second choice for a lot of folks, and they work real well. There's really no concrete evidence that there's any problems with ibuprofen right now. So I certainly won't say don't take your ibuprofen, especially if it's been effective for you in the past.
Yeah, makes sense. So all right, so we've got that figured out. What can we expect from this thing? I mean, based historically or what we're seeing now, what do we see kind of going forward? Lots of people, and I know nobody has this answer. I'm asking you a question that no one in the world has the answer to, but what can we look at? I mean, is this thing going to evolve and maybe get worse, get better? I mean, people talk about seasons changing may affect it. What can we anticipate, do you think?
So that's the problem with the novel virus. We don't really have a good concrete answer for what to anticipate. I would suspect that we're going to see a peak here in West Virginia probably over the next 7 to 20 days. And then hopefully within about 4 weeks, the cases really tend to trail off. There will probably be around 2 at some point. but that takes some time to see. Um, I would love to say that, by early summer, we won't have to worry about this, but I want to be realistic about it. And I think that a realistic thing to think about is that this is just going to be the summer that we vacation at home and do things as a family and enjoy the home life.
Yeah, I mean, I think we all have to find some good moments within all of this, right? The challenge is going to be there, but there's things we can take and
Yeah.
turn those lemons into lemonade, right?
Right.
I do see some things. There seems to be some promising treatments and different things. I know vaccines. They're hustling to get those out. That's probably not realistic to come in anytime soon. But I see this chloroquine or this malaria drug that might have some effect. Other drugs. Can you comment on any of that you're seeing out there and how realistic these are? You think?
So, there's some preliminary reports of effectiveness of chloroquine, which is an anti-malaria drug. Um, a lot of that comes from us seeing that, Africa, where malaria is rampant and many people have taken chloroquine, doesn't seem to be as affected as the rest of the world to this point. The tests are ongoing. They look somewhat promising. Again, when we're talking about something as deadly as COVID-19, and chloroquine being a very benign drug, very little side effect in just taking a dose or two, it may very well be an effective measure to save some lives down the road. I think time's going to tell. I certainly think that the thinking in the healthcare community is there's some promise here. That's why it's already difficult to get the chloroquine. Hopefully, Mylan Pharmaceuticals helps out the whole country with that.
Hopefully. What measures are in place? So we currently, at the time of recording, which I'll get this thing, I will hustle this thing as fast as we can. But so far, we don't have any cases in Taylor County confirmed. Doesn't mean we don't have any. That takes time. I understand. What are we doing as a county and our and I know there are people who are working almost without sleep, and big hats off to them. Gratitude for all the folks that are stepping up and doing their thing and trying to fight this thing. But what are we doing to track those cases? I've seen some countries and communities are tracking the testing, whether it comes in, even when they're waiting, even if it comes back negative, positive, who they're seeing. What are we doing as a county right now in that preparatory phase?
So we try to track all the cases. Excuse me. We try to track all the tests that are done. We want to know everybody who's been sick enough to test. It was a little easier a few days ago. It's getting a little more difficult, and I'm afraid it's going to get a lot more difficult to track just who's been tested. If they've been tested in Taylor County, we can track that pretty easily. It's when they go to another hospital or in a different place and have their test. The good news is, though, that all positive tests are reported to our local health departments, and so as a county, we know who has COVID-19 in our county, where they live, and then it becomes the health departments, and particularly the public health portion of the health department's responsibility to really monitor these folks.
Yeah, that makes sense. And so then have you heard or do we have strategies in terms of even who those people are interacting with and contacting them? And I mean, it's that spider web of somebody has it, who have they all talked to? I know that's a heck of an undertaking. I get it. But are we doing something like that as well?
Yeah, this is kind of uncharted for our country, frankly. I mean, and all of these people who are called epidemiologists, that's a fancy biologist who tracks disease. They've become basically they're living the most important month of their life as far as that goes. And I know the governor had asked for a number of epidemiologists to come to West Virginia to help out with our tracking. The National Guard's also helping out. But here at a county level, I mean, we are very committed in Taylor County to tracking everyone ourselves, to try and do what's called cohort studying, studying the folks they've been around, where they've been, where could they have caught the infection. And that'll help us in the short run to keep our county safer and free of the infection. And in the long run, it'll help us to track how it moves and how it affects people.
Yeah, that's awesome. I mean, that's good to know. And what I don't normally go down kind of the doomsday scenario, and I won't go there. But if we did have a huge bloom here in Taylor County, are we considering quarantine locations? Have we identified those where that would happen, or is it more going to be, hey, go home, stay at home, wait your 14 plus days? What's that look like? Just so people can get a feel of, okay, if worst case scenario happens here and we do have this huge bloom, what are those actions we're going to see?
Yeah. So everybody who is COVID-19 positive is self-quarantined for 14 days, or it could even be a little bit less if they get well much quicker than that. We don't like to talk about quarantine unless that really becomes possible, or not possible, excuse me, but necessary. I think I'd like to think that the folks here in Taylor County have good common sense and would keep themselves inside if they knew they had COVID-19 and away from other folks. And a true quarantine, would only be necessary if we just found they couldn't do that and they were endangering the public safety.
Yeah, these time like this, it reminds me of statistics I've seen through the years, and there's enough of them where we're on the wrong end of every list. But one of them that we're on the top of is that we take care of each other. We're neighborly, we help those in need, and there's no time in any of our lifetimes that are listening today where there's been a greater need probably to help one another. And so, yeah, that's huge. And to that point, what can each of us do in our own situation? What are the best things we can do obviously if we're in a certain target demographic, or even outside of that, what are things we can do to protect ourselves and protect our community?
Sure. I mean, the big things are the things I've kind of been preaching to everybody for a few weeks now. Please wash your hands 20 times a day, 30 times a day, however many times it takes. And you should wash them after every social interaction that you have in which you come within 6 feet of someone else. You should try and limit the number of times a day that you violate the 6 foot space around yourself. When you get home, you come in your house, wash your hands first thing. It's hard with our kids, so we really need to keep after our kids to wash their hands. And as I've said in the past, we need to set a good example for our kids too. They'll do what we want them to do if we show them what we want them to do, so, and then other than that, we've got to just use our common sense. Don't go out to the store 3 times a day, make a big grocery list and just make one trip somewhere. Go to a drive-through instead of a walk-in shop. Be real mindful of touching things like doorknobs and elevator buttons and keypads and ATM machines and so on, and sanitize your hands after you do those kind of things. If you do all those things, you should be safe. You should be comfortable that you're going to be safe and can rest a little bit more easily. And then I'll rest a little bit more easily.
Hey, let me throw you a curveball a little bit and dig into this. Obviously, there's the hand washing, nutrition, movement, those things. But you brought on something. It's kind of two angles. One is the stress. I mean, we're all feeling. I mean, I work remotely typically, and I travel out. But so really, the mechanics of my day haven't changed a whole lot, except for this giant existential threat that's hanging over us all, right? And so, what can we do? Some is just having these kind of conversations, realizing this thing is scary, yes, but there are things we can all do. And then what can we tell our kids? Some folks have little kids at home, they're all running around, they're homeschool, and they don't really know what's going on. Maybe they probably have fear, and they won't always verbalize that I'm scared of this disease. They might act out in other ways. What are some tips you can kind of offer
Sure.
to the parents or just all of us at home that are kind of struggling with this wild invisible thing?
Well, I'm no Dr. Phil, okay, but I would tell parents that even though your kids aren't paying attention, you don't think they're listening. They're listening. They're hearing what you're talking about. They're seeing what the television is saying, and they're reading things on the internet, and they may not express their fear to you. They may act out in different ways. They may be more cranky and irritable, and you would be wishing they were back in school. They may have trouble sleeping. They may even have trouble with their bowels or bladder. They may have no appetite. All of these things often go along with our kids having anxiety. Us adults, how do we have different ways that we can deal with the stress. We just go buy all the toilet paper in every store, but but the kids, they don't. So, I think it's real good for parents to talk very plainly to their kids. But the most important thing the parents should do is reassure their kids, reassure their children that they're going to keep them safe, and that they don't have to worry, that they're going to watch out for them, and then try to make it into something, hey, 20 years from now, 30 years from now, we'll look back on this, and this will be the year that we pitched a tent in the backyard and had a lot and made campfires every night, or this will be the year that we played a Monopoly every other day, or something like that. So, just try to take that fear out of your kid's mind a little bit, and give them a little normalcy whenever you can.
That's good advice. One of the things we're doing, even the idea of helping where you can. And so our kids, in terms of, making masks, and, even my 6-year-old daughter's reading books to the younger kids at school over video, anywhere you can help somebody, that our kids just immediately lit up when they realized they could help. They had power, they had agency, and that was huge as well. Let me ask you, kind of on that note, and kind of closing out here. Obviously this is a pandemic, and pandemics bring death and other things, and to what degree has a lot to do with how we behave as a community. But what there's some silver linings out of this, right? I mean, we're going to be hopefully more prepared in the future. These things aren't if, but when. And so hopefully we're going to be more prepared. But what are other things we can look to and say, at least we're grateful for this, or here's some silver linings. This is what's going to come out of this as a positive thing for our community.
Yeah, well, we will be more prepared for this in the future. Think this is a scenario that very few of us have ever considered very seriously, and so we'll have protocols in place. I was just talking with my wife Sally tonight, and about in the future, people won't get as scared because they'll know what to do. They'll be prepared for a pandemic, or some infectious process, and it'll be part of normal life in some ways.
Yeah, that's awesome. Well, Dr. Bender, I know you are working tireless hours. I know there are a ton of other people and organizations and folks who've stepped up. I'd love to thank a lot of them right now. If you got some airtime, I mean, I know they're out there skinning their knees and elbows and everything else, trying to keep us safe as a community. Who's out there that we want to think about, and if we so obviously from a distance, keep that air high five as we do around here jokingly with the kids. Who do we want to give a shout out to?
Yeah, I'll tell you what. I want to start with the health department. Boyd Van Horn and Sean Thorne have just been fabulous. Trying to keep our message out in the community. And Sean, I kid him. I tell him he's the backbone of the supply line in Taylor County, because he gets the supplies from the state and distributes them, and has been a real help as well. The Grafton Hospital has just been fantastic here. George Boyle's the administrator, Violet Shaw, the director of nurses. I mean, they're just working themselves to the quick, and have done a really good job. I really don't feel very worried about the hospital and their preparedness at this point. I think they've really gotten it together quickly. Down at emergency services, Bobby Beltner and Mike Kochka, I think they're prepared, getting us, if we have any, bad scenarios, they're preparing and keeping us ready for that. So I really, really couldn't be more grateful to all the folks here in Taylor County, in government and emergency services and EMS and law enforcement, as well as healthcare, that have just gone above and beyond, and frankly made me very proud of where I live and the folks that I work with.
Yeah, I think that's great. It's so easy to hang on the one negative thing you see out there, but man, there is a community coming alive for this thing, trying to help one another, and it's obvious. Right. And obviously, after we shut this off, they'll be like, "Oh, there's somebody we missed. That group too, or that person too," right? I mean, everybody's helping, and even just the average citizen who's like myself, are just trying to be distant. I'm just trying to do my thing and keep separate, and hopefully that's not a whole lot to ask of people, but it's a challenge for some, and I just appreciate everybody doing that. And I appreciate you coming on with us. I mean, these are interesting times, and having folks like yourself to be a calm voice in the middle of the storm is really valuable. And not only you're not just out there talking, you're out there getting it done. And I want to go back to the hospital again. I know the hospital, sometimes it's popular to rag on the hospital and joke about it here or there, but my goodness, thank God that we have the local hospital here in an event like this. I mean, it's just it's invaluable, and so I'm glad.
I mean,
that. And
thank you, and it does, Alex. It just makes everybody feel better to know that, close to home here, there's help for them, and they're ready to take care of everybody.
Yep, that's right. All right, man. I'm going to let you go to do everything else that we've just pushed off. I'm so thankful for you grabbing some time. Good luck. Let us know if we can get any other messaging out or anything. But in the meantime, stay safe and healthy, and we'll do the best we can to support you.
Great. Thanks, Alex.